morning, and thank you so much for joining us for this edition of SBB University. We are covering the topic of Medicare and Medicaid, which is often very confusing to people. So I'm very excited to bring on this dynamic group of ladies here with me today. I'm going to start with introductions up in my left-hand corner. Miss Mary Poster is joining us from the Hope PACE program. How are you this morning, Mary?
I'm doing well. And how are you doing today?
I'm good. Thank you so much for asking. So I'm just going to ask you to tell me a little bit about yourself and what brought you to Hope PACE.
Well, actually, I have been with the Hope organization now for 23 years. I was on the hospice side originally, and then when PACE was being thought of, I just happened to get in on the ground and just went with it. And I've been with Hope PACE now for over 12 years.
And it's such an amazing program. I cannot wait until we get to your questions because not many people know about you and they absolutely need to. It's such an amazing program. So you actually have to wait through the whole video to see that, guys. And next we have joining us, Chris Cassill. How are you this morning, Chris?
I'm doing great.
Wonderful. Tell me a little bit about yourself and how you got into the world of Medicare.
I'm an independent agent with Florida Medicare Group, which is part of Florida Financial and Insurance Group. I started getting interested in Medicare when I went on it myself and ended up now specializing in Medicare insurance, although we do health insurance for pre-65 as well.
Wonderful. And I know you're very passionate about education, so I can't wait until we get to the part where we talk about your questions. All right, Liz Moneymaker, the moneymaker of the group. How are you this morning?
Good morning. I've had my coffee. I'm ready to go.
Perfect. Well, tell me a little bit about yourself and how you got started in the industry.
Absolutely. I'm an estate planning and elder law attorney. I have two law partners, Sarah Butler and John Ferrari, because when you have a Butler and a Ferrari, you need a moneymaker. So we make a really good team. I got into elder law after being a trial attorney, after really helping my parents transition through trying to figure out long-term care and nursing home and all of that. And I realized you need someone that understands the umbrella of estate planning and end-of-life care. So that's why I do it, and I'm passionate about it. I'm also retired Army, so I love our veterans, and there's so many out there that need help. So Thank you for doing this, because I think having all of these people talking is just, there's nothing better to help our mutual clients.
Absolutely. And first and foremost, thank you for your service. We appreciate you so very much.
Welcome.
All right. So just organically, it makes sense when we're talking about aging that we're going to start with our Medicare young lady over here. So Chris, tell me a little bit about the enrollment process, and do you have to be 65?
You do not have to be 65. You can be on disability for 24 months and you will be eligible for Medicare. But for most people, it does happen when they turn 65. And it used to be back in the day that Social Security, back in the day before COVID, Social Security would automatically mail you your Medicare card. But now you have to go online yourself and sign up for Medicare. And you do that at ssa.gov. And you can sign up for either Part A or Part B or both.
Perfect. And now, what is Medicare Extra Help, and how can I find out if I qualify for that?
Extra Help, which is also called LIS, which stands for a Low Income Subsidy, is a federal program that you also apply through Social Security at that same website, or you can call us and we can walk you through it as well. Basically, it provides help for the drug part of the Medicare, your Part D premiums, and your drug costs too.
Well, thank you so much, Chris. And now we're going over to the moneymaker. Now, what are some of the myths about Medicaid? Because a lot of folks don't really understand the differences between Medicaid and Medicare. And I call it the maze of the M's and the A, B's, and C's here.
For sure. There's so many myths. I do a whole hour presentation on the myths. But I think one of the myths, I think Chris knows this well, is will Medicare pay for my long-term care? And it's yes and no, but certainly not for any length of time. It won't pay for nursing home care. So that's the myth number one. And the myth that breaks my heart all the time are people that think that they need to spend all their money. They need to like get down to zero in the bank account before they can apply. So those are the two that I see every day that just aren't true. Don't spend your money.
And don't give it away because of the look back period.
Yeah, exactly.
That's a big deal.
Exactly.
Now that really does transition us into what PACE is all about. PACE is a Medicare and Medicaid funded program. So first of all, let's just talk about what PACE is.
PACE is actually a program of all-inclusive care for the elderly. And that is exactly what we do. We do assume the care. We become the primary medical provider, and we also will become the insurance company because we are funded, like you said, with Medicare and Medicaid.
Mm-hmm. Now, this brings me back over to Liz. Now, Liz, if somebody is really close to qualifying for Medicaid, what are some of the things that they can do to pre-plan? And the first one is very important, to not give away your money, but you do need to qualify for this program in order to get into a program like Hope PACE.
Right. So to qualify for Medicaid, there are really three issues. One is being medically qualified, which I don't have anything to do with. But the other two things are qualifying via your assets. So there's an asset limit and there's an income limit as well. So when you say when you're close to qualifying, I don't know if that means close as in calendar, you need to qualify today or next week or monetarily, but
financially.
Yeah, financially. Well, it's a little self-serving, but I say talk to an elder law attorney who specializes in Medicaid planning, because I have seen so many people make mistakes that then put them into a penalty period. And that didn't mean they didn't qualify for Medicaid. It just meant there was a period of time where they didn't. Mm-hmm. So that's step number one. And then step number two is just educate yourself on things that you should and shouldn't do. Don't give away your money to your grandkid. Don't just for whatever reason put people on your bank account, because that's not going to help you qualify. There's a lot more don't do's than there are do-do's for sure.
I agree. And Mary, now with the PACE being a center-based program, I found it so interesting, the amount of services that you can get. It includes podiatry, ophthalmology, audiology. Tell me a little bit about what a typical week would look like for a PACE member.
Well, it would start with, we would have their days that they would come to our center, and they would be picked up by our bus, because we have a fleet of 37 buses now, and pick them up, bring them to the center. When they come to the center, they'd have a light breakfast and different activities going on. But most importantly is our staff. And our staff at the centers consist of not just our medical team, because our clinics are at all of our centers. We have RNs, CNAs, social workers, dietitians, but we also have physical therapy, occupational therapy, and recreational therapy. So when our participants come, they're spread out going to different areas and doing different things. But, it's almost like they actually now are starting to call it the club. They're coming to the club to see their friends, and we have entertainment sometimes, movies, exercise. I mean, they love it. Yeah. And usually for 1 to 2 days, from starting in the beginning, I don't want to go, to like, can I come 5 days? Yeah. But it's just great. They have a wonderful time. And like you said, we cover all medical, and that's dental, eyes, ears, you name it. We cover it as long as the interdisciplinary care team approves it. It's covered, and it's covered at 100% when you have your Medicare and your Medicaid.
Yeah. And that's what's so shocking to people, is they don't realize that this service is available to them through these programs. And it's just an amazing program that's out there. So we're going to bounce back down to Chris. Now, Chris, I know you mentioned Plan D, the drug plan. I want you to elaborate a little bit on why it's so important to take a drug plan from the very beginning. And I also want you to talk to us about when somebody can make some changes on their plans.
Okay. First, I would like to just address something really quick with the Medicaid part. And that is that there are different levels of Medicaid. So, if you're close, apply, you may get something, and that would be helpful. Also, that LIS, the extra help that we talked about for the Plan D drug coverage, the income and asset limits on that are much higher than Medicaid. So even if you're denied Medicaid, it's still worth it to try for LIS. Your question was, I forgot.
The first was, tell me why somebody should get their drug plan from the very beginning.
If you have original Medicare or Medicare and a Medicare supplement or Medicare Medigap plan, you do need to get a Plan D for drugs. And if you don't, you're going to get a penalty every single month that you do not have one.
Forever.
Yes.
It's so interesting how many people don't know that. And then they go through, oh, I'm healthy, I don't need a drug plan. And the drug plan was $10 a month, and they wait, 20 years.
We actually last year met a 93-year-old gentleman who never had a drug plan and was not going to get one at that point because the penalty was just.
Yeah, but if you're dealing with a serious illness and you need those really expensive medications, this can be very serious. It's that education piece is so important. And then my second question for you is, how often can you change your plans?
For most people, let me see. If you have a Medicare supplement, you can change that plan whatever you want. Okay, that's your Plan A, your Plan F, your Plan G. You've probably heard of those. If you have an Advantage plan or a drug plan, you can only change it at certain times. Everyone knows about open enrollment, which is actually the annual election period, which starts October 15th and runs through December 7th. But there are other times, special enrollment periods. If you have a change in your life, like if you move, if you go in or out of an institution, for example. And one of the big ones is if you go on Medicaid or on LIS, you're in a special election period, and we have special Advantage plans made for dual eligible people that offer fantastic benefits, including this year, they're even offering food cards now. So your health insurance will buy your food.
Wow. This is why I love doing these. This education piece is so important. All right, Liz, I'm going to bounce back over to you. This is a big one. People really don't understand with Medicaid covering assisted living versus skilled nursing. And there's a big difference between even those two programs, the Medicaid diversion program and just straight Medicaid long-term care. Talk to me about the differences of those and kind of debunk the myths on what's what.
Sure. So when you are in skilled care and you can qualify for Medicaid, then you're going to have a patient responsibility based on your income that you'll have to pay at the facility. But Medicaid pays then for whatever else that you need at the facility, and that's covered. If you're in assisted living, then it gets more complicated because there's only a finite amount of budget money for that program. So typically when people are trying to get in-home care or assisted living care, they get put on what's called a wait list. And I always tell my clients, it's not a wait list and you're on there for a period of time and you get off. It's all based on need. You could be on there for 5 years. You could be on there for a day. It's all about, the rate that the program gives you as to how much you're going to need the care. And if you're in assisted living and you qualify and you get off this wait list, then it doesn't pay for all your assisted living care. Typically, there's a range depending on the facility, but I always tell people it's about $1,100 a month that would be paid towards your care. And that doesn't typically cover assisted living care. So there's got to be something then that you're private paying. So it's usually a very eye-opening discussion I'm having with my clients about Medicaid being able to give any assistance towards
it really
living.
is. And your room and board's not usually covered, and room and board in these assisted living communities is, at minimum $3,000 in a lot of cases, unless you're getting a facility that specializes in that. And the wait list is long. And you're right. If you make a mistake and you don't fill out your application appropriately or your renewal paperwork appropriately, you're out of there.
Right.
and good luck getting back in. It's very critical that you follow the rules and know all the stipulations. All right, Mary, talk to me a little bit about the doctors there. If you have your own physician, I do know that you have to change doctors, but if they're specialists, can they keep their own specialist, or how does that work?
Well, as you stated, primary, you have to give up your primary because we become the primary care provider. But we do have a list of contracted physicians, that we use in all the different specialties, that, if the team felt that they needed to see a different doctor, like a cardiologist or urologist, they can choose from our list. If their doctor that they use now is not on the list, then we can approach them and talk to them, see if they would be interested to be on contract, or we can do a letter of intent. And usually the doctors are more than willing to work with us. So a lot of times we tell our participants that we're going to try to let them go ahead and keep their doctor or specialist.
Very good. And I know that we keep saying that this program is funded by Medicare and Medicaid, but if you are over the limits of financial stipulation with Medicaid, you can actually pay for this program out of your pocket. What does that look like?
That is over, I'm trying to think now. I can tell you that it didn't go up from last year. So it's over, I'm going to say over $3,500 a month.
Okay.
And so actually what that covers is our Medicaid reimbursement and the Part D, because we cover the medications too.
Okay. All right. Thank you. All right, Chris, bouncing back down to you. Now, one of the questions that I had was, what's the difference between, and I always get very confused with this too. What's the difference between a Medicare supplement plan and a Medicare Advantage plan?
Okay. Here we call a Medicare supplement a pay before you go plan, and a Medicare Advantage plan is pay as you go. And what I mean by that is, with a supplement, you pay a monthly premium every month, whether you use any services or not. And when you go to the doctor, depending on what plan you choose, you will have like no other bills, no doctor bills, no co-pays. You usually have a deductible for your Part B deductible, which is $203 a year. But unlike a Plan G, everything else is covered. Mm-hmm. But you're paying that healthy premium every single month. And as I said earlier, you have to have a Part D plan.
Right.
Now, with an Advantage plan, there is no premium. There are no deductibles. The drugs plan is included. But every time you use it, when you actually go to the doctor, you may have a little copay. And usually, like if you go to your primary care, it's $0 usually. And the specialist, $20, $30. When you go to the hospital, so much per night. So that's pretty much the difference. The other difference is, of course, with an Advantage plan, you get the dental, the vision. Mm-hmm. A lot of time you get gym memberships and a lot of other little perks.
Right. And from my years in senior living, I know that traditional Medicare was always a kind of what's the word I'm looking for? Not required, but appreciated. Talk to me a little bit about why, when it comes to, skilled rehabilitation centers and getting into the hospital and things like that, why traditional Medicare might be a better option as you age.
Traditional Medicare by itself is probably not a good option. With the copays that you have to pay on Medicare and the deductibles, you can get in trouble really quickly. I mean, the Part A deductible alone is over $1,400 when you go into the hospital, and they want that money up front when you walk in.
Wow.
So if you have just Medicare and not any other type of plan, then you're responsible for that up front.
Okay.
So
all right.
You do have to sign up for Medicare Parts A and B before you do anything else, but just having Medicare is usually not the best option at all.
And that's why people need to talk to someone like you. All right. One last question before we wrap things up. Liz, the word retroactive when it comes to Medicaid, is it retroactive when you're coming into the community like that? Like if somebody's waiting for their Medicaid to go through?
It's retroactive to the extent that if I apply on April 28th, it would be retroactive to April 1st. So
Okay.
that's the retroactivity that's in effect right now.
Okay, perfect. All right. Any closing remarks? Miss Mary, did you have anything to add?
Well, I just want everyone to know that this program is like, it's going to keep you independent. It's going to keep you we want you to stay living in your normal surroundings, which is at home, and you're going to do better in that situation than going anywhere. And we do that by having you come to our center, by driving the bus with your medical, and also providing some home services also. So just give us a call.
Definitely an aging in place program.
Yes.
You can't, if you're already in a facility, you can't even qualify for it. So you definitely want to start, once you have a health situation, that's what qualifies you for it. So definitely.
Exactly.
Thank you, Mary. All right, Chris, any closing remarks?
Yeah, we'd just like to tell people not to put too much stock in those ads they see on TV or those flyers they get in the mail. If you have questions about Medicare, speak to an independent agent, someone that can tell you all the different plans and sits down and explains things to you. And I'd be glad to do that.
Perfect. Thank you. All right, Miss Moneymaker, what you got for me?
What I got is I just want to thank Seniors Blue Book because you do a great job of connecting the entire community. Like, I didn't know these ladies before this morning, but we're going to have coffee soon because they have resources that can help my clients. So thank you for that.
Absolutely. Well, thank you, ladies, so much for your time and for joining me this morning for SBB University. Until next time, have a great morning.
All right. Thank